So a typical day at Hennepin County can be a variety of things, but most common is to work with individuals in helping them achieve their health or wellness goals. And as part of our overall strategy for Hennepin County and improving the lives and the health of our employees and their families as well, that's why we offer health coaching.
The whole first year, you are completely immersed in self-awareness. You're immersed in understanding yourself, understanding your biases, understanding who you are as a person, as well as developing the techniques for health coaching. And that then launches you into the second year, which is the opportunity then to feeling more secure and more centered in who you are as a person, with all of your loveliness and all of your shadows, and using all of those skills and techniques to facilitate an opportunity for somebody to have the same self-awareness and then to grow from that. So yeah, it's been interesting. It's been a cultural change. I think this is the time in history where we're going to be the change, because patients are asking for integrative health care.
I came to the U because I was thinking about going to nursing school, and through my prerequisites I decided to take some classes in the center just to kind of flesh out my education. And I've always been interested in complementary, alternative, CAM type healthcare, and that it was like once I had my hand in the cookie jar I couldn't stop. And so I just started taking classes and then applied to the certificate program in integrative therapies without the health coaching first, did a round of classes, and then discovered the health coaching and went from there. So I've taken a lot of classes at the center, all very awesome. The program had a huge impact on me personally, just increasing my own self-awareness and self-compassion. It's a huge aspect of what I gained from going through the program. And then as far as working with clients and patients in the future, I think the take-home message from this program is that honoring everyone's individual wisdom, and I'm not the expert, you're the expert, and it's my job to help you find that expert within you and elicit that internal wisdom, and that's the key to kind of stimulating the intrinsic healing process. So that's a lesson that I think can be applied to any field in healthcare, and not even in healthcare. I mean, it can just keep going and going and going. It's a useful lesson for everyone. So.
I graduated from the program at the University of Minnesota in Integrative Health and Healing Therapies, part of the Center for Spirituality and Healing, in May of 2010. I'm a nurse by training, and I work for 3M. My title is Medical Complaints Investigator. And what I do is I interact with customers on a daily basis, physicians and nurses and consumers who may be having some medical issues as a result of using our medical products. And I use my coaching skills with every single interaction all day. And we work through the issues that they're having and try to understand what has happened and how they could do things differently. In the program, I learned a variety of communication skills that have been very helpful to me. First of all, in being open when people contact me and being ready to listen to what it is they have to tell me, to allow them to express themselves completely before I come in and make judgments about what they have said or are saying to me or what their experience has been. And I learned about words like saying, I'm curious about this. I'm interested in hearing more about this. What can you tell me? So the phrases and things that I learned in the program are helpful to me in my communication with other folks. We are birthing an organization, and our small group from 2010 has been meeting monthly, and we keep saying, okay, why are we meeting? Why are we meeting? What do we want? And we decided, we kept looking outside of ourselves and outside of our group, outside of our state, for a skeleton program or ideas, and it isn't there. And so we thought, well, let's be the leaders, let's carry the flame, and let's us be the beginning of something new on a state and national level. So that's what we're thinking about, and that's why we met. And we're going to meet again. We're going to meet on a quarterly basis and start putting something together, because we feel that this new profession is much needed